Hi, Dr. John Torres here on my sorry about that, Dr. John Torres here on my Doc to Doc series, where every week I talk to an expert around the world about things medicine, about things health, and particularly about the coronavirus and the pandemic. But sometimes we focus on other topics as well, and sometimes we combine the topics, which is what we're doing today. But to help me do this, I get experts in this field that we can go ahead and pick their brain and find out what the information is, and particularly the information you need to know to help you, your family, your loved ones, and your community get through this pandemic sooner rather than later, and get through it as healthy as possible, and to keep you as healthy as possible. And today, to help me do that, Dr. Marie Navar. Dr. Marie Navar. She is associate professor in the Department of Internal Medicine and Population and Data Science at the University of Texas Southwestern Medical Center. She's a board-certified cardiologist. And Marie, thanks for being here with us.
Thanks for having me, John. Happy to be here.
Yeah, and
happy Heart Month.
Let's start off first with talking about COVID and heart health, because that news came out recently, and talking particularly about COVID and how it's affecting the heart even 12 months later after somebody has it. How important is that to understand?
Well, I think the first thing we're talking about COVID and heart health is, the short-term risk is not over yet. So just last month when I was rounding in the hospital, we still are seeing lots and lots of patients with new coronavirus infections who are coming in with all sorts of cardiovascular complications. And that's something we've known from the get-go. COVID causes heart attacks, strokes, blood clots that could go into our lungs. So all sorts of heart and vascular complications. And that can happen in healthy people, and it happens even more often in people who have existing heart disease. So before we talk about the long-term thing, we have to make sure that we can even get people there. And the most important way to survive coronavirus infection is to be vaccinated. So really important still for everybody out there who hasn't had a chance to be vaccinated and boosted, get that shot, because it can dramatically lower your risk of having short-term heart complications from coronavirus. And it's extra important if you have existing heart disease or cardiovascular disease, because you're at the highest risk group. Now, the long-term stuff is something we're learning more about.
Yeah, real quick before we talk about the long-term implications, when we first started talking about coronavirus 2 years ago, and for the first year or so, we talked about it being a respiratory virus, but then we found out it also is a vascular virus, right? It's affecting the vascular system, and that's why we're having these heart issues.
Yeah, as a cardiologist, we like to think that everything revolves around the heart and the blood vessels. The reality is that our whole body is connected together. So, the lung complications are really important, and that's what causes needing to be on a ventilator and the pneumonia from coronavirus. But we know that also once you get infected with coronavirus, there's a bunch of problems, not just with the big blood vessels in our bodies, but the tiny little ones where you get little microvascular clots and problems in circulation. And those are causing some of the other really serious complications like heart attacks and strokes, both from the blood clots, but also just the inflammation of being ill can make you more susceptible to those clot-related effects like strokes and heart attacks.
And that's short term. Now, long term, affecting our heart.
So long term is something that we're still learning more and more about. There's probably two different pieces. The one that we actually know more about is related to long-term heart disease risk from everything that's happened to us in the pandemic. We've seen blood pressure levels go up, people with diabetes having a harder time keeping it controlled, alcohol consumption's gone up, physical activity rates are lower, people are eating more junk food. All of that is contributing to sort of increasing overall risk factors for heart disease in the population. So a lot of us are worried on the cardiovascular side of things, over the next several years, are we going to be seeing more patients with heart disease because these risk factors kind of went out of whack?
And this is what you're talking about specifically is regardless of whether you had COVID or not, regardless of whether you had vaccinated or not, these are affecting everybody essentially.
Totally. The pandemic, the stress of the pandemic, job loss, the lockdowns that we've had, financial insecurities, worry, all loss of loved ones, all of these things have sort of led the population as a whole to kind of do a little bit of worse cardiovascular behaviors than we may have optimally liked. The good news, it's not too late. So, a year or two of not exercising is not going to make a long-term difference. It's making sure that doesn't turn into a habit over the long run in the future.
But then we add COVID to that. If somebody gets COVID, it complicates things.
Absolutely. So there's some that are a little bit more obvious in terms of long-term risks. If you had COVID and you got myocarditis or an infection in the heart muscle, that can affect your heart function. If COVID caused a heart attack or a stroke, there are long-term risks there that you're going to need to be seen for and taken care of. This other sort of syndrome is something harder to understand, which is what we're calling long COVID. And, we are seeing people who've had COVID infection who get over all of the acute stuff, but then continue to have sort of a variety of really life-limiting symptoms, many of which are heart related. So, feeling really exertionally fatigued or having really fast heart rates, those sort of kind of heart related symptoms that we don't completely understand the biology of, or even the best treatments for. And there's a lot of research going on to try to really understand what's the long-term risks of COVID to the heart in people who have long COVID, but even people who don't have long COVID. We just don't know yet if there's going to be long-term heart risk from having COVID infection. I hope the answer is no, but it's something we're going to have to keep studying.
In the study, the VA study, which is the big one that we're all talking about right now, even those that had mild COVID ended up 12 months later having some heart issues, some of them. And so, whether you had it severe or mild, just getting it can make things bad.
Yep. And, there's a just challenging to understand links between infections and inflammation and our immune response to that and what happens to us over the long term. So, the more we keep learning about COVID, sort of first the short-term impacts of it, and now some of the long-term impacts of it, the more reason for us to do everything we can to try to get this pandemic behind us and to keep ourselves safe and protected.
Well, let me ask you this, because I hear this a lot from people. I don't want to get the vaccine because I'm worried about getting myocarditis from the vaccine, that heart inflammation. What do you tell them?
So the first thing I tell people is I totally understand the fear. And I think it's important for all of us who are vaccinated or ourselves are taking care of people who are afraid of vaccinations, that most people who are declining vaccines aren't doing it out of some political agenda. They're doing it because they're trying to make what they think is the best choice for their own health. So I always start from a framework of, where do we agree? And most people are trying to do what's safest for their heart. So as a cardiologist, I sort of look at the overall picture of, what's the risk. It is true there is a very, very, very small risk of myocarditis, which is an inflammation in the heart muscle after vaccination. The risk is highest in young men, so sort of teenage and early 20-year-old men. Most older adults, people with existing heart disease, are not in that high risk group. So that's a good thing because they're at the highest risk of COVID complications and really need the vaccine. But that risk is somewhere in about 1 in 10,000 and 1 in 100,000 people. So it's very, very low. And although it's true that, it's a severe thing if you get inflammation in the heart, so far what we know is most of these cases, they don't lead to deaths and they recover. So there's a short-term inflammation in the heart function may be lowered for a short while, but from what we've seen in the studies, these cases get better with time, which is really reassuring. But you have to remember that the benefit of vaccine eclipses the risk of the vaccine overall. So vaccinated people are much less likely to have a heart attack or heart complications from COVID. They're more likely to live if they get COVID infection. They're less likely to infect other people who might be at risk of having complications. So generally speaking, we don't think that the small risk of myocarditis is enough to outweigh the big benefits of vaccination.
Excellent. Thanks. And one of the reasons I wanted to have you on today is because February is American Heart Month. It's time to focus on the heart and focus on ways, even outside the pandemic, even outside COVID, to get the heart healthy, because, that's your life's goal there. And that's, obviously important for all of us to make sure. But let me ask you this first question. When we say somebody's at high risk for heart disease, what do we mean by that?
It means that compared to, the general population, your chances of having a heart attack or stroke are higher than most people. And it's a qualitative estimation. There's no magical number, 10%, 20% that says you're at high risk or not. But we know at the general population level, heart disease is the #1 killer of Americans, men and women both. More people, including women, die of heart disease than they do of cancer. And so we need to think about, how do we treat risk factors in people who are at high risk? And how do you not get into the high risk category to begin with? What can you do from your lifestyle or potentially medications to treat risk factors to prevent getting heart disease in the first place?
So that prevention is key.
Absolutely. And, I tell my patients that it's both never too early to start thinking about heart disease prevention, but it's also never too late. So we have a lot of studies that show that even once we're in our 60s or 70s, if you start doing things like controlling blood pressure, controlling cholesterol, quitting smoking, you can lower your future risk of heart disease, no matter what you've done for the last several decades. So important for all of us who may have fallen off the wagon a little bit during the last 2 years to know that it's not too late for us to start making important changes to lower our risk in the future.
It was interesting today. I heard a thing on the radio and they're talking about people are ordering more furniture now, even though the pandemic is, kind of getting to a point of winding down, not over, but looking that way. And they say the reason is because they've worn out their couches, which means they've been sitting on their couches a lot. It's time to get up and move again.
Absolutely. It's, people think a lot about exercise, but I think your point is really well made about just movement. In fact, one of the first studies that showed us that exercise was good for you or that physical activity prevented heart disease wasn't a study looking at exercise. It was actually a study of bus drivers and bus ticket takers in London. And it was a great study because they ate the same food, made the same amount of money, lived in the same areas, but half of the people drove the bus and half of the people went up and down the double-decker buses in London all day, just walking back and forth, taking the tickets. And they found really dramatically lower rates of heart disease in the ticket takers compared to the bus drivers. And because everything else was the same in the group, the only thing they had to explain it was physical activity. So we know beyond that, exercise is really important. And I don't want to downplay the importance of aerobic exercise, but just movement during your day is critically important to staying active and helping lower not just your risk of heart disease, but even things like dementia, cancer risk. Exercise and physical activity are good for all sorts of medical conditions that we don't want to get.
And I always say it's the little things that count during the day. Those little things add up. And I know we're all tired of hearing this, but it is true to park further away from the store and walk into the store, take the stairs instead of the elevator or the escalators. Those little things, going to somebody else's office instead of sending them an email, they can add up during the day, and that adding up really goes a long way towards keeping you healthy.
Well, and the research supports that too. People get demoralized when they get an activity tracker and they're not hitting that magical 10,000 steps. That's 5 miles a day. And, I maybe shouldn't confess this on a national Facebook channel, but I don't walk that far in a single day, and it's okay. So the observational epidemiology studies show that there's a big difference in mortality and heart disease outcomes, even if you go from like 4,000 or 2,000 to 4,000 steps. So for those of you out there who are trying to increase your steps, it's not trying to get to 10,000. It's just increasing the number of steps that you're already doing. And those little things that you mentioned, Joe, really do add up.
Sleep, how important is that?
So important. And it's probably both important directly for our health, but also indirectly, because when we sleep more or we sleep well, we eat better, we move more, our stress levels are less, and all of those things contribute to our health. And it's not just the number of hours you sleep. Turns out there are other factors related to our sleep that matter. The quality of our sleep. So people with undiagnosed sleep apnea are kind of waking up multiple times in the night snoring. That sleep doesn't count as much as a really good solid sleep where you're breathing through the night. Or sleep regularity. So even if you account for the number of hours that someone's sleeping, if you're sleeping in the same hours each day, like you go to bed at 10 and wake up at 6 every day, your risk of heart disease actually looks lower than if you're sort of changing your bedtimes, but still getting that same 8 hours. So my message for the busy folks out there who may not be able to find extra 2 hours a day to sleep and get that 8 hours would be at least try to make what you have really count. So try to go to bed at the same time and wake up at the same time. And then avoid things that are going to impact your sleep, like caffeine later in the day, alcohol in the evening. Those things will decrease the quality of your sleep.
Those are great tips. Now, as far as the person around the average person here in the U.S., looking at their heart health, And it might be hard to quantify one way or the other, but what's more important for them, statins or aspirins?
Oh, that's actually a pretty easy question. For the majority of people in the United States, meaning those who do not have existing established known heart disease, aspirin probably isn't going to make a big difference in your overall risk of a heart attack or stroke. There is a group of people that have evidence of heart artery blockages or cholesterol deposits in their arteries who haven't had a heart attack or a stroke. Those people may benefit. And if you have a lot of cholesterol or calcium in your artery walls, many cardiologists will recommend an aspirin. But for people who don't have known heart disease or stroke, aspirin will increase your risk of bleeding and probably will not decrease your risk of heart attack or stroke in a meaningful way. On the other hand, statins, which are cholesterol-lowering medications, are one of the most effective ways to prevent the cholesterol from getting into our artery walls to begin with. And so many people are recommended for statins, even if their LDL cholesterol isn't extremely high. But to get the LDL cholesterol lower or as low as we can to try to prevent the start of the cholesterol getting in the artery walls to begin with. And that's really one of the most effective ways to prevent heart attacks and strokes, and certainly more effective in the sort of what we call primary prevention population than aspirin, meaning people who haven't had a heart attack or stroke in the past. But that's a big asterisk because there's a lot of people have heard this news about aspirin who have heart disease and think that maybe they shouldn't be on aspirin. If you've had a heart attack or stroke, please don't stop your aspirin without talking to your cardiologist. This has been a really big issue for us in the last couple of weeks.
And statins do you think more people should be on statins? Are people not going on them because they think they're going to have side effects, or they start and they stop them?
So I actually know that more people should be on statins. So when we look in all sorts of different databases, there are people that we know will benefit from a statin. People with diabetes, people with high cholesterol, people with multiple risk factors for heart disease, and even people with established heart disease. When we look, large proportion of people who really should be on a statin are not on one. And there's really two reasons for that. There's a group that it's our fault. We as doctors are failing to recommend the therapy. We don't check the cholesterol, or we don't recognize that the person's at high risk. And so we're not even offering it to the patient. So, important to point out that a lot of the blame needs to be on us, on the medical system, for not offering it to all the people that need to. But there are a lot of people who are really afraid of the potential side effects of statins, many of which have been completely overblown and are often misinterpreted, and actually part of even disinformation campaigns that have made people much more afraid of a statin than of the heart attack that the statin would prevent.
Another either or, and this is a daily decision people go through: sugar, salt. Which one's worse for our heart?
Everything in moderation, I would say.
Hey, I love that.
You don't have to choose, John. You can have a little salt and you can have a little sugar, and you're not going to get heart disease.
But little being the operative word.
Yeah, and if you want to have cake on your birthday or holidays, it's fine. Probably for a population, the amount of sugar that we're consuming in the US is contributing to a lot more heart disease than salt. So salt is really important for certain people. If you have high blood pressure or heart failure where your heart pump doesn't either squeeze or relax the way it should, limiting salt is really important to keeping you out of the hospital and to keeping your blood pressure controlled. Probably at a population level, excess sodium does contribute to high rates of high blood pressure in the population. But the excess calories that we get from sugar contributing to the obesity epidemic, sugar causing prediabetes and diabetes complications, is probably a bigger contributor to heart health and heart problems than salt is. And most people don't really realize where they're getting a lot of the sugar from. Sugar sweetened beverages, sugars that are hiding in packaged foods and processed foods really are, they really add up during the day for somebody. But if you want a teaspoon of sugar in your coffee in the morning, you have my blessing.
Thank you for bringing that up too, because one of the things I've been saying for years, one of my mantras is everything in moderation. You don't have to cheat yourself with these foods because that means you're going to crave them. You're probably going to eat more than usual. But if you hold back and just do it occasionally, that's okay. Like you mentioned, have cake on your birthday. That's fine. But just don't have cake every single day of your life. That's not good. And so you have to look at these different factors in there. Last question I want to leave with is, people look at their own family histories and they have a family history of heart disease. And sometimes they think, well, there's not much I can do about it. Completely untrue, right?
Absolutely. So your genetics are not your destiny. They change your risk. They change the possibility that you can get or develop heart disease. But there's so much that you can do to avoid that risk. In fact, we've done studies where we take people who have multiple genetic risk factors for heart disease. And if you look, those people who adhere to, heart healthy lifestyle, the American Heart Association has something that's called the Life Simple 7, sort of lifestyle things that you can do to stay healthy and prevent heart disease. Those people are at much lower risk than people who have perfect genes, but aren't doing everything right. So you can 100% undo the family history or help, combat the risk that you get from your genes through not just lifestyle, but also sometimes through medication. So a lot of people for whom heart disease runs in the family, there's elevated cholesterol or other things that we would treat with medications like statins, for example, or blood pressure medicines, that working with your doctor, there's a lot you can do to help prevent having the same heart disease that ran in your family. But you can't do anything about it unless you get those numbers checked. So for Heart Month, if you haven't had your cholesterol checked in a while, probably time to get your LDL repeated. Make sure you got your blood pressure checked at your doctor's office or you're checking it at home. Because a lot of these risk factors are totally silent. So especially those with a family history of heart disease, figure out what your risk factors are, talk to your doctor about what you can do, because many people can avoid heart disease if they get on the right therapies early.
And Anne-Marie, I know you agree with this. You want to start as early as possible, but it's never too late to start at the same time. So if you haven't, this month, perfect month, it's American Heart Month. And that's why we have you on as a cardiologist from UT Southwestern Medical Center, that, to give us information about our heart health, what we can do to improve things. And the other thing is, a lot of people might not know that you also, if you go to Twitter and TikTok, you have some raps in there where you're rapping about heart health. And my hat's off to you for doing that. And they're fun to watch. Thank you very much.
Well, thank you. And maybe I'll just make a plug for, instead of my Hamilton parodies on Twitter, the American Heart Association website, heart.org, or the American College of Cardiology's CardioSmart pages have really great information that's fact-based. It's based on research. It's the same information that we cardiologists trust to make recommendations to our patients. Totally support people being informed. And those are two great resources for people out there who want to learn more about heart health.
Great. Could not have said it better myself. Thank you very much. And thank you again for helping us stay as healthy as possible, especially starting things off for February and the American Heart Month. Appreciate this. Is Dr. Marie Navar from UT Southwestern Medical Center, cardiologist, and giving us a lot of good information. Anne-Marie, thank you very much.
Thank you, John. Have a great Heart Month.
Thanks. You too.